From the scratch, I'll explain a little about my company. That I'm coming from Habitat. We are the distributor for Masimo, and then we are distributing the Masimo here in UAE for last 20 years, like time. And this is a model called Radical-7, which is a pulse oximeter, which will have different parameters like SpO2, the pulse rate, and then the perfusion index. We will discuss it later, very detailed. The next thing is like I'll go with the hardware. It got four parts. The first one is the docking station. This is the docking station for the charging the device, and this is the module, actual module, which is calculating SpO2 and displaying SpO2. Then we will connect it here, like for the charging. This is how we are connecting. So that means you need to first install the base here, okay, properly, and then put it inside. So you'll get a big sound, and that means it's already locked. Next thing is like you can connect the power here, from here to the power cord, so that the charging mode will be active. Okay, you can see here the charging and the battery charging here. And switching on the device, the next I already talk about two components, and the last two will be the patient cable and the sensor. Sensor is disposable and it's available in the store, I guess. How to switch on the device? Switch on the device here. Press on the power button. Press and release, so it will be ready. So we'll wait for a second, and then the system will boot, and then you can either place the module like this one, or you can just place here, and then you can place like this. So the preferable method is like this, so that you can save more spaces, and when you don't have space. The system will automatically align the screen according to your view, or according to the position of the docking station. You can see it now. Comes to the system, I'll take it out and then I'll explain it. Comes to the system, you can have SpO2 value, pulse rate, and PI, and the pleth waveforms as well. Okay. The first thing we can do is to setting up the patient profile. Okay. So if you go here from the right corner, you can see here normal and custom. If you press the custom, then it will show you the patient profile. So, and then in that patient profile, select the appropriate one. So if you are going for adult, choose adult, and pediatric, like that. Okay. And then the sensitivity mode, which is very important in in our values when we are recording. It goes 3 sensitivity mode. That's only Masimo has that sensitivity mode. The first one is normal, and you can see max and upward.
What is max?
Max is like when you have a low perfusion, very low perfusion, and you are not obtaining any values of SpO2. That means then that time if you use max, then it will wait for a second time, and then it will collect the maximum value in that period. Okay, that's the max. So in case of neonatal patients, they are not getting any values, you can use it. Yeah. In all other cases, use the normal mode. Normal mode should be the one. Okay, then press OK. Then go here, you can see a port. Just press on that one, so it will move that to normal. But again, it should be adult. Yeah, and don't look into that, okay? Because I think. Yeah, that's okay. Now, and then you can hear, you can just press, you can know the battery status. Yeah. This is for alarm silencing. You can silence the alarm volume. You can adjust the alarm volume, or you can adjust the pulse tone, and you can adjust the silence duration. Now it's default set it up 2 seconds. So once you press the alarm silence here, so it will silence for like 2 minutes time. Yeah. Then after that it will again start up. Right. That's the time and date. If you want to change anything, we never touched it. So if you need to change it, then we will change it for you. The good thing is, like, the other good thing is, like, if you don't need to see pulse rate in a bigger way, then you can go here and then just drag it down so that it will be down, and you will get it this one. Okay, and if you press on SpO2, you will get the alarm limits. You can know that what is SpO2. You can just go in, yeah, and then the trend, histogram.
The trend, what was the previous, like,
can see
2-3
probably
hours
previous.
Yeah.
previous readings I can.
Yeah, you can.
You can see, yeah?
Yeah. And then if you it's already in bigger position, then even if you don't need this one, then you can go down, and then anytime you need it bigger, then just press it there and it will be there. Yeah, so this is all about this device. The next connection, the connection will come here. You can see there is a patient cable. We are connecting the patient cables to the system first. So you can see the Masimo is written over here. Just connect Masimo to that module. Okay, make sure that it's connected well, so it will not come out. Okay, when you're taking out, you just press on the either side and then pull it out. That's it. Yeah. The patient cable is connected. I'll make it on the system. Now the sensor is here. So I advise or I suggest you to connect the sensor first, either in the digit 4 or digit 3, and then wrap it to avoid external lights like this. Then once you connect it, you can see that it will be aligned so that the disturbance of patients will be very less, because the cable is very flat. If it is round, then it will create more.
So it should be like that, or it can be other way around, like this cable can be on the other side. It's okay.
You mean the downside? No, no.
It should be always.
It should be always like this. Okay, because I'll show you. Here you can see here the light source here. Okay, and the detector is here. Okay, the light should be here and the detector should be always in the down. Okay, light should be always on the nail, and then connect it here. You can see the set here and then the cable like this. So these two colors should be together. And wait for a second. Start reading. I got good PI, that means the area, the digit I selected is very good for the result.
Less than 1 is poor.
Less than 1 is like, in that time you just need to check the hand whether it is very cold or not. So if it is cold, then make it 1, or check another digit which is already like good PI. But the good thing is, like, the device, it will be reading the values even if it is very low PI, very low like kind of blood flow. But sometimes we will not get any value, especially for neonatals. So that time you need to check the hand, or wherever you are applying, you need to check that. For babies, maybe we are connecting in the leg, right? Sometimes, yeah. But you don't have any NICUs here?
Yeah, we have. They are having this one.
Okay, so we done with the connections, and the result is here. If you want to make it the other side, it will automatically align. So that's once you're done, Just remove this cable and then try to, now it will start. So once the alarm is here, you can see here it will start counting.
If it gets wet, it will work.
This one?
Yeah, because example patient is going bathroom.
With this one, no?
No, we never promoted this one, but because we don't need to want to make it wet.
We have to
Remove and
random.
then apply new one. That's the better option. Yeah.
How many inside?
It's 25 bucks.
Okay.
Nothing. It's like a
How about the charging time?
charging time. You can charge up to like 4 hours time, and it will be fully charged. You can see here. Once it's charged, you can see here the charging.
And
amount.
how many hours until it will get
You
fully
will
charged?
get 4 hours of timing if you're using as standalone, like in handheld. If you use from out from the charger, if you're using it, then this way you'll get 4 hours.
4 hours.
And if you're discharging continuously, you can run continuously up to n hours
Yeah.
on the road. Yeah. Okay, you go here, you press here, and then you've seen it, and then you need to go back to the home screen. Just press on the home screen, so it will automatically go there.
So this is good for home screen.
Yeah, the home screen.
What is this for? This one?
This is for the patient profile. Once it's press here, you don't need to like go
there,
here. It will be difficult, right?
Yeah, to always press here. So I can just press here.
Press here, yeah. So that you can select the patient
It's
profile.
better that is easy.
Yeah.
Anything else?
That's it.